We see people of all ages. Commonly we see people starting in their teens when they come in with acne. We also see people in their 20s and 30s and they might be showing signs of rosacea. We also see people in their 40s and above that will have sun damage. They'll possibly have melasma, which is hormonal pigmentation, and we treat all of those. Most people are a candidate who have maybe pigmentation from acne, which is post-inflammatory pigmentation. We also have people with sun damage and melasma, and the doctor will review with them that they're a candidate and explain the protocol, which is usually 5 treatments, and that'll be once a month. We treat pigmentation and rosacea with IPL, which stands for Intense Pulsed Light, and it's wavelengths that are going to be treating the skin and attracted to the browns and reds. And by doing that, the pigmentation will burst out of the cell structure, come to the surface, and the body will expel it or basically just powders off the surface. With maintenance, we recommend they complete their series, and then once a year they come in and have a treatment that will just help to manage, may not get rid of it completely, but it's going to help to manage the signs of rosacea. So for somebody with acne and they have made it to the point where they are under control, the maintenance part of their treatments, we have something that can treat the inflammatory pigmentation that's left behind. That would be the browns, the purples, the pink scarring that is left on the surface. We treat that with laser, which would be our pixel, and that's going to create thermal channels into the tissue, and that will help to stimulate new collagen and smooth out the scar tissue.
I think you can break it into 2 categories. We have the true lasers, which are ablative, useful for fine lines, wrinkles, pore size, and then the non-ablative IPL therapies, which we use for sunspots, vascular lesions, flushness in the face, rosacea. Pixel is a true laser. Just like we talked about, it's going to create a thermal channel, a destructive cell, and introduce a large amount of thermal energy, waking up your body's healing process. Again, that's used for fine lines, wrinkles, pore size predominantly. IPL is a bandwidth or group of wavelength of light, typically around 540 to 570 nanometers. We use that color of light because it gets rapidly absorbed, preferentially absorbed into brown spots or red lesions, blood vessels, and that thermal energy then disrupts that abnormal pigment in the skin, causing your body to either speckle it to the surface or to absorb it internally over a period of about a month. So IPL is non-ablative. You can get that treatment here with a large flash of light that only destroys the unwanted pigment or the blood vessels, and you could leave here and not know anything was done. I think the biggest difference between medical providers is the level of supervision and physician application. So first of all, these spots aren't all the same, and the first thing you want is a physician making sure that what you're going for treatment is a sunspot and not a basal cell carcinoma or a melanoma that could be actually covered up by treatment instead of intervening when you need to. The other thing is the state is very clear about this. This is a medical procedure that should only be done by the hands of a physician to make sure that the laser or the IPL application is performed safely and without harming a person. I think they're popular because nobody likes or loves the aging process. Certainly we all love the sun, we love being exposed to that warmth and that heat, and it does rejuvenate us internally, but unfortunately our skin over time develops brown spots, lesions, blood vessels become elasticized and they stay dilated. So people wind up getting red and brown patches, things that they might feel are unflattering on their face, and we offer the services to remedy those.